Sunny 95. Sunny 95.
Welcome to The Reasons We Smile with Dr. Kvitko, the show that brings you man-on-the-street interviews, celebrity guests, groundbreaking research, and heartwarming stories about the reasons we smile. Our show is also known as everything you've always wanted to know about dentistry, but we're too numb to ask. Hello, I'm General Dentist Dr. Kvitko, and thank you for joining me today.
The following views and opinions do not necessarily reflect those of this station, its staff, management, or parent company. To hear a replay of this show or one of the great shows that previously aired, log on to thereasonswesmile.com or iTunes, keyword Dr. Kvitko or The Reasons We Smile. Listeners should not use Dr. Kvitko's comments and advice in place of an actual dental exam.
Brighten your life with a smile that shows the professional touch of Dr. Kvitko.
Time now for The Reasons We Smile with Dr. Kvitko. Call 459-9769 to discuss your dental issues. Now, here's your host, Dr. Kvitko.
Hello, everyone. Welcome to The Reasons We Smile. I'm Dr. Kvitko. This is episode number 563. Thank you so much for joining me. I really appreciate it. The title of today's show is, during the various procedures, dental procedures that I perform, what is my brain saying to my hands, and why does it matter? Part 2. All right, we covered a lot of things last week, but there were so many more that I did not get to that I decided to do a Part 2. Before we get started, I'd like to remind you, if you'd like to follow me on Twitter, it's at Dr. Kvitko. And if you would please go to my office Facebook page and like us, that would be awesome. It's at Dr. Kvitko. All right, all videos, all of our past episodes, complete with video, are available at thereasonswesmile.com. And we are streaming live on Facebook right now. So far I've been pretty good on Facebook. I think I might have this thing figured out. We will see. Anyway, okay. Oh, and by the way, if you're watching on Facebook or if you're watching on thereasonswesmile.com, maybe on Monday or Tuesday or whenever, and I look off to what looks like your left, it's because I'm looking at the clock. The clock's on the wrong side of the room, so I'm looking at the clock now. Sorry. On Facebook it looks correct, but on the videos it's backwards. Okay, so like I said, what's my brain saying to my hand when I'm doing these things? One of the big ones is root canals. Now, root canals strikes fear in people's hearts, and it really shouldn't. Root canals are boring. They are somewhat long and tedious at times for the dentist and the staff, but they're boring for you. And those of you that have had one at my office know what I'm talking about. We've even talked about that. But here's the thing. And we were using this as a way of understanding how much training goes into being a dentist who can do a lot of these different procedures. And so while we are looking at you and smiling at you and telling you how awesome you are doing and making sure you're not sore, you're not feeling anything, and you know that you're not too cold, not too hot, and that the music is what you want to listen to, or the television is on the right station, what we're really thinking, or what I'm really thinking is, I wonder how many canals are in this tooth. Not that I'm not supposed to know, because a molar has 3 canals typically. However, upper first molars, more often than not, have 4. And sometimes they can have 5 or 6. And so, as I'm doing a root canal, I'm thinking, okay, I only see 3. Where's that 4th? Or I found the 4th. Could there be a 5th? Could there be a 6th? Because each one of those can cause discomfort afterwards. If there's a 5th canal and I don't see it or feel it if I do see it, then you're going to have some post-operative discomfort. It's going to feel like maybe the root canal is not completed. The same with the 6th canal. Okay? So that's one thing I'm looking for. How many canals are there? Oh, and by the way, there's this other one. What if there are 3 canals, or 3 orify, if you will, 3 openings? But then when I go to fill, I figure out all my lengths, right? We're going to figure out that this one is 18 millimeters, this one's 19 and a half, that one's 21, okay? So I go to put the root canal filler in there, and the one that was 18 and a half is perfect. The one that, the one that was 19 and a half only goes in 16 millimeters. Well, what happened? Well, turns out in some cases, the canals can join. They join about 3/4 of the way up. So, is it a canal that joins with another, or did I just not get it in far enough? So those are the kind of things that I'm thinking about. And there are ways for me to figure it out once it happens, but sometimes it's a bit of a surprise. You know, you don't know what's happening 3/4 of the way, 16 millimeters or 15 millimeters inside a tiny little hole, but based on doing it for several years and based on seeing x-rays and extracted teeth, there are times when I look at it and I go, oh, okay, well, those two just came together, so I think we're good. All right, so that, but then there's another one. Okay, what if we find the canals, we can see them all, we know where they're supposed to be, and we see 3 black dots or 4 black dots, which we know are most likely where the canals are, and yet we can't get into it, and yet it's called sclerosed. It's like calcified. Now, we can say to ourselves, hey, if it's sclerosed, probably not going to hurt the patient. We'll just leave that one. We'll not do that one. But again, good 90-95% of the time, it's only sclerosed where we're trying to get into it. Not really sclerosed down inside where it matters. And why does it matter? Because at the end of each root tip, there's a little opening, and bacteria can get in that opening, and they can live inside the tooth, and they can be, if they're in there, your body, the bloodstream in your body, can't reach them. So they can live and breathe, and their toxic products go out the end of the tooth, and that's creating an abscess. That's what causes the pain, and that's basically the definition of somebody who needs a root canal. And yet we had a sclerosed canal, right? We couldn't get into it. So what we do instead is we assume that we have to get into it, and so then we have all of these other instruments that we can use. We have, sometimes it's a laser, sometimes it's a rotary instrument, sometimes it's a hand file that if we can kind of wiggle it in there. Sometimes it's an endodontic explorer, which is a big, long, pointy thing that we can maybe push into the opening and maybe get a start, and then once we get a start, we can get the file to go in there, or maybe we can get the rotary instrument to go in there. I've even used a pin drill before, so if you're a dentist listening and you haven't thought of that, give that a try someday. If you have it lined up properly, it's designed to drill in, and so a millimeter or so, I can drill into this black dot that is now sclerosed. That gives me access to this canal in a lot of cases, and then I can get it fixed. But what my brain is saying to my hand is, you need to figure this out. Okay? Now, what if the canals are curved? So I'm working on this, and I'm going, wow, that's quite a curve, and not only does it curve to the right, but it curves to the left, about halfway up. Now, we have rotary instruments that do that, although we have to be very careful, use a lot of lubrication, a lot of irrigation, go slow, use the correct RPM and the correct torque. And so I'm thinking about all that. Wow, I have to be really careful as I go into this one that turns right then left, and I have to use lots of liquid and so on and so forth, okay? And then in the meantime, I'm also saying to myself, my brain is saying to my hand, I hope your patient's still numb. Hope they're numb enough, maybe I need to give them more before it starts to wear off. And then once I'm in, and I have all of my links, and I've debrided and cleaned out and changed the shape of the inside of all of these canals, whether there's 3, 4, 5, or 6, I'm also thinking, when it's time to seal them, am I going to be able to get my sealer, which has usually got a percha, all the way to the very end? I don't want to go out the end too far, because if I do, I can cause a little bit of inflammation there as well. If the gutta percha, which is rubber, goes out the end, it should not react because it's inert. It's not supposed to react with tissue. However, if I go too far, it could cause a reaction because the body's going to go, wait a minute, there's a foreign object here. I don't know what this is. But also, I don't want to be short either because, again, bacteria can live in your tooth. So those are the kind of things that go on in our head. And I also need to think about while I'm working on you. And by the way, I always gauge what I'm going to do post-operatively by what I'm seeing when I'm doing it operatively. So if I see pus coming out of your tooth, man, I'm going to give you a stronger antibiotic than somebody else. If it stinks to high heaven in there, same thing. If it's, and it does, folks, it does. The other thing is this infection too extensive to completely heal from simply the root canal? I'm thinking about that. Because remember we did a show about fistulas where you get this granulation tissue that grows, body's trying to heal an area that is being is infected in some way, and it just can't. So then I have to think, okay, maybe I need a root canal and some surgery on this one. Also, when I put the irrigation solution in, I have to be thinking, I want to make sure it's rinsed out properly, and by the way, that solution kills bacteria, rinses it out, and it's going to go a long way to make sure that we're going to have a nice, healthy root canal when it's done. Root canal procedure. It's actually called endodontic procedures, but most people call it a root canal, which is incorrect. I was reminded that in an English class once in undergraduate at college. It's a root canal. It's an endodontic procedure. But anyway, so when I put the irrigation solution in, How much should I use? I want to rinse it out properly, but I don't want to inject it into the body, right? It's not supposed to be an injection. It's supposed to be a rinse. So I have to be careful not to let the needle lodge in your tooth root, and then it kind of goes out the end. And I have to make sure I know how to do that. So that's what my brain is saying to my hand all the time, that I'm just working and it's this boring procedure and you're wondering what I'm doing and, worry that it's going to hurt at any moment because root canals you've been told, are terrible. And like I said, they're not. But that's a lot of communication, right, between my brain and my hand, or any dentist that's doing this for that matter. And so I think it's a kind of a neat insight to kind of learn about that sort of thing. And root canals can be very, very tricky because of the extra canals, because of the curved canals, and just making sure that they're filled to the right measurement, but they're not overfilled, and that you get a great seal. And if we do that, these things last for a lifetime. I mean, you get a root canal, it should be there for the rest of your life if it's done well, and if the tooth itself has been restored properly. So teeth that have had root canals, they wind up getting brittle over time, right? They get very brittle. And why is that? There's no longer a blood supply inside. And the blood supply is the nutrients, is the liquid, if you will, okay? Keeps it moist. And so if you just have a root canal and you don't have a crown, you're probably asking for trouble, because it will crack over time. And now you spend all that time and effort on a root canal, and now your tooth split down the middle, okay? And then you have to have it extracted. So don't do that. Sometimes people do it to save money. Well, let me just do the root canal today. I can tell you that's a bad plan. Why? Not that it's not going to save you money right today, but the bad plan in this regard, more often than not, people who do that, once the pain goes away, they never get the crown. And they're the ones who the teeth are either being extracted, most likely being extracted down the road. And that just seems like such a waste, folks. Okay, so I have a whole list of things. Some of the things we're going to cover are: what is my brain saying to my hand when I'm making dentures? What is my brain saying to my hand when I'm placing implants? When I'm doing intravenous sedation? When I'm doing gum grafting? When I'm dealing with fistulas? And when I'm looking to see if your tooth is cracked? That's going to be coming up after the break. As you may know, we always do a Dr. Kvitko's question of the day, and it gives you a chance to win free flowers from DeSantis Florist. And so we always make the questions very simple and easy, so if you listened at all, you're going to know what the answer is. And so just keep in mind that a few of the things that I'm looking for, my brain is saying to my hand while I'm doing a root canal, is, will I find an extra canal? What if I find fewer canals than I expect to? And what if one of the canals is sclerosed or calcified? Okay, if you remember those, you're going to win. All right, before we do the contest, though, we'd like you to listen to this.
This station will not be held liable for any contesting during The Reasons We Smile with Dr. Kvitko. Participation in the contest allows Dr. Kvitko to record and broadcast your name and call. One winner per household. Prizes are non-transferable, cannot be substituted, and are subject to taxes and fees. This station cannot be responsible for the inability to enter the contest, whether due to equipment malfunction or telephone difficulties. All decisions of Dr. Kvitko concerning this contest or eligibility are final.
And now it's time for Dr. Kvitko's question of the day.
All right, well, I am performing... Oh, wait a minute. Let me just give you the phone number so you can be ready, all right? 614-459-9769. And remember, you're going to have a chance to win free flowers from DeSantis Florist. Here's the question. While I am performing endodontic therapy, also known as a root canal, what are some of the things that my brain might be saying to my hands? Is it A, will I find an extra canal? B, what if I find fewer canals than I expect to? C, what if one of the canals is sclerosed? Or D, all of the above, all right? The winner's going to receive those free flowers from DeSantis Florist. They'll be delivered to your place of business this Tuesday afternoon. The number to call, 614-459-9769. That's 614-459-9769. So go ahead and call now.
You won't believe it though. I wanna hear your mind, and there's nothing else in the world tonight. She said, people don't take the time. Hey, people don't take the time.
Hi, I'm Keith Carlos, winner of America's Next Top Model and star of Chocolate City 2. Look for my smile on the big screen this summer, courtesy of Dr. Kvitko. Stay tuned to The Reasons We Smile with Dr. Kvitko, the world's most interesting dentist.
Hi, I'm Dr. Kvitko, general dentist and host of the Reasons We Smile radio and roadshow. Did you know that you no longer need to visit several different dental professionals to get more complete dental care? We handle everything from cleanings and orthodontics to restoration, implants, and smile makeovers, all in my office. And now we have 2 locations. Get the most advanced technology and procedures available today. It's more complete dentistry.
Visit worldsmostinterestingdentist.com for more info about Dr. Kvitko.
Dr. Kvitko, let's go!
Hi, this is Richard Simmons. Dr. Kvitko's here, and he's going to help you with all of your problems. Are your teeth yellow? He can fix that. Are you missing a tooth? He can put a new one in. How is that?
That's very good. Thank you, Richard. All right, we're back. We're doing Dr. Kvitko's question of the day, but we don't yet have a winner, so let me just restate the question, give you the phone number, and if you're out in your car or driving around, whatever, you can call in and win these free flowers from DeSantis Florist. The question is, while I'm performing root canals, what are some of the things my brain might be saying to my hands? Will I find an extra canal would be A. What if I find fewer canals than I expect to? B. And C. What if one of the canals is sclerosed or calcified? Or D. All of the above? It's probably very obvious because all of those sound logical to me. Anyway, 614-459-9769 is the number. I will move on with the show, and then my producer will let me know when there's a winner on the phone. Okay, so let's talk about dentures. When I'm making dentures, what is my brain saying to my hand? You know, I'm looking at you. I'm asking you to close your mouth. I'm looking at you. Smile. I'm saying, put your lips together and hum lightly. That sort of thing. And so what am I trying to do? Think about, okay, if you close your mouth, go ahead and close your mouth, let your teeth touch. When you close down and your teeth all come together, that is what we call vertical dimension of occlusion, the distance between your chin and your nose when your teeth touch. But if I were to say, go ahead and just relax, or maybe let your lips just barely touch like you're going to hum lightly, what would happen is your teeth would be missing. They wouldn't quite touch. Not missing, I'm sorry, I said that wrong. Your teeth would not touch. So there'd be this little distance between your chin and your nose. Okay? That's what we call the vertical dimension of rest. When your jaws are at rest, your teeth don't touch. So I'm trying to figure that out. That's what my brain is saying to my hand. You think I'm just saying things like, okay, I want to see your smile. Okay. Tell you what, looks like we have a winner, so we're going to go to the phones now. We'll come back to this in a minute. So who do we have? What's your name?
Lori Johnson.
Hi, Lori. How are you? Thank you so much for listening and for calling in. Lori, do you have the answer to Dr. Kvitko's question of the day?
All of the above.
All of the above. Hey, were you thinking about all the things we're thinking about during a root canal? Have you ever thought of that?
No, actually I haven't.
It just feels like, hey, he's going to do a root canal and I'll be out in 45 minutes, right?
Right.
But there's a lot to think about. Lori, what do you do for a living?
I am a nurse.
Oh, awesome. Okay, so then this is probably interesting to you because your brain talks to your hand every day, doesn't it?
Yes, it does.
Yeah, you know exactly what I'm talking about. Last week we had a pharmacist call in. I think all of us medical folks kind of understand this process. So anyway, hey, thank you so much. Stay on the line. We want to get the information where we can send you those flowers, okay?
Okay, great. Thank you.
You're very welcome. Okay, so back to dentures. Okay, so we're talking about vertical dimension of rest, vertical dimension of occlusion. So think about it. Somebody walks in with no teeth, none in their head, and I'm supposed to make them teeth that line up their smile. How far does their lip protrude? You know, how do the lower teeth line up with the upper teeth? And, of course, they teach us all that in dental school, but it's tricky at times, and I much prefer if somebody comes in and they still have at least 2 teeth that touch when they bite, because that gives me the vertical dimension of occlusion, so I can build from that. But I just did 2 folks at the office last week who came in with no teeth, and came out just fine. But I'll tell you what, though, it's tricky, because I have to put a dot on their nose and a dot on their chin, and this guy had a big beard, and I kept losing where my dot was, and it's tricky. I also need to think about what shape should the teeth be? How tall should the front tooth be from gum line to biting surface? How wide should it be? You know? All of that kind of stuff. What color? It depends on the quality of the ridge. If the ridge is pointy, that could be a sign of discomfort down the line, you know? A pointed ridge can be hard to make comfortable. So sometimes those people are going to wind up with a soft reline down the road because it just feels like teething pain or something. Okay? So that's pretty much it for dentures. But there's a lot of things there are a lot of things that my brain is saying to my hand that you've got to get this right, Doc. You know? Okay, let's do implants. When I'm placing an implant, first of all, before we ever place one, we've done a lot of background work. We've done a cone beam scan x-ray, so now we know exactly how many millimeters we are from, say, a nerve or the sinus if it's an upper tooth. But then, at some point, and we also have to look at the other two teeth that we're going in between, because if we line up, let's say one tooth is leaning in a little bit and the other tooth straight, so do we put the implant straight or do we put the implant leaning up against like the other one, crooked like the other one? Well, the answer is neither. What we do have to do sometimes is if one tooth is leaning forward, we have to shave a little bit off of that one to line it up with the guide plane, if you will, of the other tooth, so that when the crown goes on, it has a way of sliding in and out. So my brain is saying to my hand, Doc, you better get this right. If you put this crooked, this crown's never going to go on and off. If you put this, if you don't get it centered, now it's going to look funny and too much pressure on one end over the other. If you get it too close to the tongue side, it's going to be awkward. If you get it too close to the cheek side, going to be awkward. So my brain talks to my hand an awfully lot when I am placing an implant. A lot. I'm making sure there's enough lubrication so I don't burn the bone. I have to keep in mind before I ever do this, if you're a smoker, there's a good chance your implant isn't going to take. If you are on antidepressants, there's also a good chance your implant isn't going to take. If you're on both, there's even more of a chance. Now, I'm willing to try, and I guarantee people that if it doesn't take in the first year, I'll redo it at no charge in the first year. But after that, if it turns out it still doesn't take, then we have to start thinking either it's your bone, or it's or the fact that you smoke, or that you're on antidepressants. Okay, there are some things that make it a little trickier for implants to take. But so yeah, am I using the right torque? Am I using the right finger pressure? Do I have my hand angled in, out, back, forward, or backward? All of that. Is the saline solution we're using outdated, or is it fresh? All of that stuff. So it's a lot, and it's good for you to know that we don't just take it lightly, that we actually are thinking the entire time. And I'm sure Lori, as a nurse, first thing she does, do I have the right patient? Is this solution outdated? What's the actual, what has been prescribed? What drug am I supposed to put in this IV bag and that IV bag? And how often am I taking vitals? All of that. What is this patient allergic to? And so on and so forth. Am I going to find a good vein? Right? Sometimes they have to have multiples. So, anyway. Okay, it looks like we're about up against the break, so you're listening to The Reasons We Smile with Dr. Kvitko, episode number 563. When we come back, we're going to talk about what is my brain saying to my hand during IV sedation, gum grafting, and fistulas. All right, we'll be right back.
You can't take me as I am, not just a little bit. I don't know who to be. I'm a paper cup, baby, of the sea. I know you see it too, 'cause you're too much for me.
This is Clark Kellogg. Stay tuned for more of Dr. Kvitko.
Estás escuchando con Dr. Kvitko aquí en su estación favorita.
Hi, I'm Dominique Reichert. Like what you hear? Why not use the show to promote your product or service by becoming a sponsor? Call 614-262-9588 to learn how. That's 614-262-9588. Call now.
Hi, I'm Dr. Kvitko, general dentist and host of the Reasons We Smile radio and roadshow. I've been honored to help several famous people get a perfect smile, like Keith Carlos and Dominique Reigard from America's Next Top Model, and Ted the Golden Voice Williams from right here in Columbus. Isn't it time you had a celebrity smile? It costs less than you might think, and most of the time, it can be done in one visit. A new smile can make a world of difference.
Visit worldsmostinterestingdentist.com for more info about Dr. Kvitko.
I'm Grandpa, and I go to Dr. Kvitko, and I still have all my teeth. Real ones. Where's my glasses?
We're back. Thank you for joining me. I'm Dr. Kvitko. you're just joining us, this is episode number 563 of The Reasons We Smile with Dr. Kvitko. And we are talking about what is my brain saying to my hand during certain procedures that I do. And so we've talked about root canals, we've talked about dentures, and we've talked about implants. Now we're going to do intravenous sedation. So intravenous sedation, obviously this one's pretty heavy at times because we really have to think about the person's overall health. You know, I have a patient who has had I had a patient who had a heart transplant. We did not do IV sedation on him, but had I needed to, I would have definitely needed a consultation with his transplant surgeon and his cardiologist. I have a patient who had a heart attack, and we are probably going to do some IV sedation on him coming up soon. And we will have to, again, have a consultation just to make sure that we're not using any drugs that could become an issue. But we do need to know, are they allergic to the drugs that we are about to give them intravenously? We need to know if they are diabetic, and if they are they brittle or are they under control? I think about things like, am I going to be able to find a good vein? You know? And there are people whose veins just pop out, and there are people whose veins you can see until you go to access them, and then they kind of just disappear, or they roll. And then there are people who just don't appear to have any veins, and yet we know they're alive. I mean, they're breathing and talking to us, so they have blood in there somewhere. We just can't find it. And I don't like hurting people, so I don't want to have to be sticking them multiple times to find this vein. I have one patient who had been addicted to drugs or had used illegal drugs, needles, years ago, before coming to me, and she told me, she goes, I ruined all of my veins, I only have one good one, it's in my foot, can you use that? And I looked at her with a little bit of surprise at first, but I'm like, yeah, I can use that. I mean, she showed me, and that's what we did, and that's something. So, also, are our drugs fresh? They're not outdated. The amount of drip, want to make sure that we have the drip fast enough to keep the cannula from clotting over, from the clotting inside. We also know that when we give somebody IV drugs, they get it very quickly, so we have to be careful not to overdose. Underdosing is easier to tell because they're still talking to me, but overdose, they might get too deep, and we want to avoid that. My type of sedation is officially called conscious sedation. So, but you know what? There are times, especially for a dentist doing IV sedation, there's this little quandary. I need patient participation. I need, oftentimes, if you're doing knee surgery, you don't need the patient awake. You just knock them out till the knee surgery is done. But for me, I'm going to need to know, I need the person to bite. Tap, 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 close your mouth, put the marking paper in there. Let's say I'm making you a crown. I need you to tap, tap, tap. So there's going to be a time, and I always tell people before I start, I'm going to need you to wake up a little bit so that you can tap and tell me how the bite is, or at least I'll be able to check it. But I always worry, the only thing they're going to remember is, I woke up in the middle, so he must not have given me enough. You know, stuff like that. So, anyway, also we monitor a person's breathing and pulse with a pulse oximeter and an EKG machine and all of those things that we keep looking and listening to the beeps on that machine. So it looks like I'm just about out of time, and I want to thank you so much for listening. And there are a few that we did not get to. Maybe we'll do those on a future show. But, so yeah, I just want to thank you guys. Like I said, 563 shows. It's been an honor. Looking forward to next week, 564th show. Tell your friends to tune in, because what we're trying to do is educate people about dental care so that it's not so scary. All right, that looks like that is all the time I have. Don't forget to follow me on Twitter. Visit my office Facebook page and like us. It's Dr. Kvitko and Associates. Remember that all past episodes, complete with video, are available at thereasonswesmile.com. Be sure to tune in next week and every week right here on your favorite station. Goodbye.
This is Carly Red from Love and Hip Hop Atlanta, the hit show on VH1, urging you to tune in next week with my dentist, Dr. Kvitko.
If you're interested in learning more about this and other dental health topics, go to thereasonswesmile.com to access full episodes of Dr. Kvitko's show.
If you'd like Dr. Kvitko, the world's most interesting dentist, to speak at your next event, please call 614-262-9588. That's 614-262-9588, or send an email to speaking@thereasonswesmile.com.